Start. Can I start?
Yes, ma'am.
Good evening, everyone. Myself, Dr. Aanchal, and we exam mastery live class in which we do rapid revision of all the important topic. Volatile facts are and revision will be here. We discuss high topics of all the subjects and no expected topics will be covered for all the university exams. Then in Oracle, we provide live classes, and in today's class, we're going to have the long and short questions. In long questions, we're going to discuss about a very important breathing disorder, and next we're going to discuss about the decompression segments. Then, in short questions, we're going to discuss about the ODC, about Bohr effect and Haldane effect, chloride shift and reverse chloride shift. Then, hearing, beer inflation reflex, and how the respiration is regulated by chemical mechanism. Then, we're going to discuss about the pulmonary circulation and the perfusion. Ventilation and perfusion. Then we're going to discuss about the ventilation perfusion ratio, and in the last, we're going to discuss about the acclimatization. So in Oracle, we provide live classes for the elevated learning of the students where knowledge meet interaction. Then also we provide recorded classes so that the student can have the access of all the subjects anytime, anywhere. Notes are being provided with CBME based question answers, MCQ and full zone for self-assessments. And MCQs are there from beginner level to expert level, which contain standard multiple choice questions. Also, student can book a slot for a personalized counselor session in which they get direct interaction with the counselor. We provide subscription plans starting from basic to mentorship. Basic plan is of 3 months, standard plan is of 6 months, and mentorship plan is of 12 months. In mentorship plan, we provide recorded classes, live classes, live doubt clarification, one-to-one personalized guidance, notes, quick revision, examination module. And this mentorship plan costs around 50,000. Also, for instant 20% discount, you can use my code, that is Dr. Aanchal 20. So let's start with today's class. So first we're going to know about the pulmonary circulation. That what is pulmonary circulation? So pulmonary artery supply deoxygenated blood pumped from right ventricle. Okay, so from with the help of inferior vena cava and superior vena cava, the blood is going to enter to the right atrium. Okay, so as the blood will enter into the right atrium, it will goes into right ventricle. So after leaving this right ventricle, this artery will divide into right and left branches, and each branch enters the corresponding lungs. Okay, so lungs are there, and here there will be oxygenation of blood will occur. Okay, so each branch enters the corresponding lungs along with primary bronchus, and after leaving the lungs, the branch of the pulmonary artery from here, pulmonary artery will carry the blood from the right ventricle to lungs. Here oxygenation will occur, and from lungs, pulmonary vein is there, which again keeps the blood into the heart. Which part of the heart? From to the left ventricle, and from left ventricle finally to the from right atrium, from left atrium to left ventricle, and from left ventricle to the aorta, and from aorta to the bone. Okay, so in pulmonary circulation, we only study about the moving of blood from lungs to from heart to lungs and from lungs to heart. This is all about the pulmonary circulation. Here we do not talk about the aorta part and about the rest of the body part and about superior vena cava and inferior cava. But to make a clear picture, I have taught you about the whole circulation, but only in pulmonary circulation we talk about the circulation of blood from heart to lungs and from lungs to heart. This is all about the pulmonary circulation, right? Fine. Now, next we have the ventilation perfusion ratio. Okay. So, as the name suggests, ventilation perfusion ratio. Okay. So, it is the ratio of alveolar ventilation and the amount of blood that perfuse the alveoli. right? And also we express this in the form of V by Q. Okay, so this is the alveolar ventilation perfusion ratio, in which V is alveolar ventilation and Q is blood flow. Fine. Now, if we talk about the normal value of this ventilation perfusion ratio, so the normal value is 0.84. Okay. And how we can calculate this ventilation perfusion ratio? So we can calculate by using this formula, that is ventilation perfusion ratio. So we have a formula, that is alveolar ventilation upon pulmonary blood flow. Okay. Now, how can we calculate this alveolar ventilation? So, for calculating the alveolar ventilation, we have a formula. So, alveolar ventilation so the formula is tidal volume minus dead space into respiratory. Okay, so we can easily get it. The tidal volume is 500. This dead space is around 150 ml, and respiratory rate we know that is 12. So we get 5,000. Sorry, not 5,000. 350 into 12. So we get around 4200, right? Now we know that alveolar ventilation we have find out, that is 4200 ml per minute, and pulmonary blood flow is around 5,000 ml per minute. Okay, so we can easily calculate it by using this formula. So we'll get this ratio, that is right. Now, as we can see in the picture, this is the normal one, perfusion and ventilation, right? Where gas exchange is occurring between the capillary and the alveoli, and we get the ratio is 0.8. But in the shunt perfusion, where perfusion without ventilation is occurring, and it can occur in the cases like airway obstruction and pneumonia, there will be low V by Q ratio. And in dead space ventilation, where ventilation without perfusion is there, that occurs in the case of pulmonary embolism and cardiac shock, there will be high V by Q, right? I hope this topic is clear to you. Now, what is the significance of finding this ratio? So, ventilation perfusion ratio signifies the gases exchange, okay? And it is affected if there is any kind of change in the alveolar ventilation or in blood flow. Like we can see in the case of shunt perfusion, where ventilation without perfusion is occurring, that is shunt perfusion. And in case of dead perfusion, where again the ventilation is there. Ventilation without perfusion, right? Now, next we have another topic, very important topic, that is ODC. ODC means oxygen dissociation curve. Okay. Now, what is this curve actually, and what is the significance of this curve? Okay. So, this curve demonstrates the relationship between the partial pressure of oxygen, right? As we can see on this x-axis, right? And the percentage saturation of the hemoglobin with oxygen. Okay, and it explains the hemoglobin affinity for oxygen. Okay, with the help of this curve, that is also known as sigmoid curve or S-shaped curve, right? So normally in the blood, the hemoglobin is saturated with oxygen up to 75%. Okay, The saturation is up to 75 to 95 to 97%. Okay. Now, the saturation of hemoglobin depends upon the partial pressure of oxygen, and when the partial pressure of oxygen is more, means hemoglobin is accepting oxygen, and when the partial pressure of oxygen is less, means hemoglobin is releasing oxygen, right? So now, one is the very important thing about the P50. As we can see, this P50. Okay, so what is this P50? P50 is basically the oxygen tension. Okay, oxygen tension means the partial pressure of oxygen at which the hemoglobin saturation with oxygen is 50%. Okay, so this is how we can plot it. Fine. Fine. Now, next thing, that what are the factors in which they are responsible for affecting this oxygen dissociation curve. So we can easily see there is shift to right and shift to left. Okay. So here this is shift to right and this is shift to left. Right. Now, we're going to discuss about various factors which are responsible for shifting the curve towards right, and what are the factors which are responsible for shifting the curve towards left. Okay. So first, we're going to discuss about the shift to right. So whenever there is decrease in partial pressure of oxygen, whenever there is increase in partial pressure of CO2. Okay, so obviously, if the partial pressure of oxygen increasing, means CO2 will increase ultimately. And if this CO2 will increase, means there will be increase in the hydrogen ion concentration, because CO2 is directly responsible for formation of H plus ion concentration, and also there will be increase in body temperature, and there will be excess of presence of 2,3 dBg. Fine. Now, next we have shift to left. So here everything will go opposite to right. So here there will be increase in PO2, decrease in this, then decrease in H plus ion concentration. So, and decrease in body temperature, and there will be increase in pH. Okay, so these are the factors which are responsible for shift to right, and these are the factors which are responsible for shift to left. Fine. Okay. Now next we have the Bohr's effect. Okay. So here we have the difference between Bohr's effect and Haldane effect, but we're going to understand both these things one by one. Okay. So first we're going to discuss about the Bohr effect. Okay. Now, what is this Bohr effect? Bohr effect is the effect by which the presence of CO2 decreases the affinity of oxygen decreases the affinity of hemoglobin for oxygen. Okay. And this is invented by a scientist. This concept is invented by a scientist that was known as Christian Bohr. Okay, and this was invented in 1904. And according to him, that that in the tissues, due to continuous metabolic activities are there, so the partial pressure of CO2 is very high and the partial pressure of oxygen is low, right? So due to presence of pressure gradient, the carbon dioxide enters the blood and oxygen is released from the blood to the tissue, and presence of CO2 decreases the affinity of hemoglobin for oxygen. So it enhances further release of O2 to the tissue, and ODC curve will shift towards right. Okay, fine. Another thing is Haldane effect. What is this Haldane effect? So according to Haldane effect, that this is the effect by which combination of oxygen with hemoglobin displaces the CO2 from hemoglobin. Means whenever the hemoglobin will combine with oxygen, ultimately the CO2 will get displaced. Okay, and also this concept was given by a scientist that name was John Scott Haldane, and that's why this effect was named as Haldane effect. Okay, so whenever excess of O2 content present in blood will cause the shift of the CO2 curve to right. And what are the causes of Haldane effect? So Haldane effect causes are very so many causes are there, like due to combination with oxygen, hemoglobin becomes strongly acid, and it causes the displacement of CO2 from hemoglobin in several ways. Like high acidic hemoglobin has low tendency to combine with CO2. So CO2 get displaced from blood. Another reason could be that because of there is acidity. So hydrogen ion are released in excess, and hydrogen ion will bind with bicarbonate ion to form carbonic acid, and carbonic acid will get dissociate into water and CO2. So the CO2 will release from blood into the element. Okay, so these are the both concepts of Bohr and Haldane effect. Now, what is the main difference between both of these that we're going to discuss? Okay, so Bohr effect means there is decrease in the oxygen affinity of a respiratory pigment such as hemoglobin response to decrease blood pH resulting from increased CO2 concentration in the blood. Okay, so ultimately, whenever CO2 content will decrease, ultimately there will be increase in the CO2 content in the blood. Whereas the Haldane effect means Haldane effect means decrease in the CO2 affinity of hemoglobin in response to increased blood pH resulting from increased oxygen concentration in the blood. Okay. Now, as we have discussed, the Bohr effect was given by a scientist, Christian Bohr, and this was given by John Scott Haldane. Okay. Now, according to Bohr effect, it occurs at the metabolizing tissue. Okay. But Haldane says that it occurs in the lungs. Okay, Bohr effect describes the release of oxygen, but Haldane effect describes the release of CO2. This Bohr effect, effectively under the low blood pH, and this Haldane effect occurs under high blood pH. Now, this Bohr effect caused by the take-up of CO2 in the metabolizing tissue, whereas this Haldane effect caused by the uptake of oxygen inside the lung. Then this Bohr effect facilitates the release of oxygen in metabolizing tissue, and Haldane effect facilitates the binding of oxygen to the hemoglobin. So these are the main points about the difference of Bohr effect and Haldane. Fine. Now next we have chloride shift and reverse chloride shift. Okay. So reverse or chloride shift, both are the very important phenomena that we're going to discuss. Okay, is there anyone who can tell me the another name for chloride shift? I'm giving you 10 seconds. If anyone can tell me the another name for chloride shift. No one is there? Okay, I will tell. The another name for chloride shift is Hamburger phenomena. Okay, so this is the another name for chloride shift. Okay, now we're going to understand that what is chloride shift. Chloride shift means it is the exchange of chloride ion for a bicarbonate ion between RBC and plasma through RBC membrane. Okay, so if this is RBC, so this is the exchange of chloride ion with bicarbonate. Okay, this is chloride shift. Okay, and again, this was discovered by the scientist. Name was Hartog Jacob Hamburger. That's why this name is known as another name for chloride shift is Hamburger. Okay, now this chloride shift occurs when the CO2 enters the blood from the tissues, and in plasma, plenty of sodium chloride is there. So sodium chloride get dissociate into sodium and chloride ion, and when the negatively charged bicarbonate moves
out of the cell. So in replacement of that, the chloride ion will enter inside. Okay, so this is how it occurs. But when we talk about this reverse chloride shift means everything will occur reversing, right? Now, what will happen here? So this is the process by which chloride ion move back into the plasma from RBC. Okay, so means if this is the RBC membrane, so this chloride ion will move from this RBC to the plasma. Okay, now as we have learned that this is the phenomena by which the chloride ions are moved back into the plasma from the RBC when blood reaches the alveoli of lung. So it occurs in lung and it helps in the elimination of CO2 from blood. Okay, and the bicarbonate is converted back into carbon dioxide, which has to be expelled out. Okay, so this is all about the chloride shift and reverse chloride shift. So more in chloride shift and reverse chloride shift, most of the bicarbonate then move out of the erythrocytes into plasma in exchange of chloride ion, and the excess of hydrogen ion binds to deoxyhemoglobin known as chloride shift. But in reverse chloride, everything will happen reversely, means the reverse occurs in the pulmonary capillaries and CO2 move down its concentration gradient from the blood to alveoli. And here, hemocritic of venous blood is 3% greater than the arterial, and venous RBC are more fragile. Okay, and basically both the phenomena are reverse to each other. Fine. Now, next we have the another important topic, that is Brewer inflation reflex. Okay. So this is also known as the protective reflex. This is the protective reflex. Why this is the protective reflex that we're going to learn? So this is the protective reflex, and this is responsible because it restricts the inspiration and prevents overstretching of lung tissue. But when it occurs? So whenever during the process of inspiration, tidal volume gets more than 1000 ml, and we should know that the normal value of this tidal volume is 500, but it gets more than 1000 ml. So what will happen? Excuse me. There will be stretching of lungs. So stretching of lungs will cause stimulation of stretch receptors in air passage. And whenever the stretch receptors which are present in air passage get stimulated, so they will generate impulse, and impulse will travel through the vagal afferent, and there will be inhibition of DGN. DGN means dorsal group of neuron which are responsible for the process of inspiration. Okay, because it contains inspiratory neurons. Okay, so if there will be inhibition of DGN, so means there will be inhibition of inspiration. Okay, so this is how this phenomena work. Okay, so this is the phenomena because it restricts the inspiration and limits the overstretching of lung tissue. So reverse of this reflex is known as hearing Brewer deflation reflex, as it is known as inflation. So the reverse will known as deflation, and it takes place during the process of expiration. So during expiration, due to absence of stretching of lungs, deflation will happen. Okay, so this is all about the Brewer inflation reflex. Now, another thing we have is the chemical regulation. Okay, now the process of chemical regulation is very, very important, and I think it is very important for the university exam also. Okay. So, in chemical mechanism of regulation of respiration is operated by the chemoreceptors. Chemoreceptors are there. So chemoreceptors are those receptors which are responsible for detecting change in blood constituents. Okay, and the change in blood constituents which stimulates these chemoreceptors, the change can be occurs whenever there is decrease in PO2 means in the case of hypoxia, or whenever there is increase in PCO2 means hypercapnia, or whenever the hydrogen ion concentration get increased. Okay, so these are the changes in which the chemoreceptors can be stimulated. Okay, now there are two types of the chemoreceptors: central chemoreceptors and peripheral chemoreceptors. Okay, central chemoreceptors are those receptors which are present in brain. That's why they are named as central chemoreceptors. And peripheral chemoreceptors are present in periphery, okay, other than the brain. So, peripheral chemoreceptors are the chemoreceptors present in carotid and aortic region. Okay. Now we're going to learn about the mechanism, the whole regulation, and that we're going to learn with the help of a flow chart. Okay. So, whenever there is decreased ventilation, okay, whenever the person visited to the high altitude, so ultimately it will lead to decreased ventilation. So decreased ventilation means there will be decrease in PO2, increase in hydrogen ion concentration, and increase in PCO2. Okay, and all three factors are responsible for the stimulation of chemoreceptors that already we have learned. Okay, so whenever there is decrease in PO2, so there will be stimulation of peripheral chemoreceptors. Okay, decrease in PO2 means there will be a condition of hypoxia and there will be low perfusion of oxygen to tissues. So the peripheral chemoreceptors will get stimulated. So they will generate impulse, and the impulse will travel through what we have learned, travel through carotid and aortic now, right? Now, from here, whenever there is increase in PCO2, so the PCO2 will diffuse into CSF. Okay, and it will lead to formation of hydrogen ion. Now, how it will form the hydrogen ion? So before learning that, we should know that this hydrogen ion is the most potent stimulator. Okay, it is the stimulator, and how it get formed. So the CO2 get diffused into CSF, and there it combined with water. So it will form the carbonic acid. So carbonic acid get dissociated into hydrogen ion plus bicarbonate. So there will be more hydrogen ion, formation of hydrogen ion. Okay. So this will stimulate central chemoreceptors which are present in brain. Okay. Then this hydrogen ion cannot cross the blood-brain barrier in CSF. So it will give the mild effect here. So it will again stimulate the peripheral chemoreceptors. Now, both peripheral chemoreceptors as well as central chemoreceptors, both are responsible for stimulating DRG. Stimulate DRG. And we know that DRG is the center of inspiration. Okay. So, inspiration, more inspiration will be there. So, there will be increase in the ventilation. Okay, so this is all about the chemical regulation of respiration. Okay. Next, we have the other important process that is known as acclimatization. Okay. Now, what is acclimatization? I think this is the important topic and usually tasked in the university exams also. Okay. So, acclimatization means adaptation. Okay. So, we can also call this mechanism as adaptation. So, this is the adaptation, or we can call this is the adjustment by the body in high altitude. Okay. So what happens whenever suddenly we visit to high altitude. So we know that there is low partial pressure of oxygen is present. So while staying for high altitude for several days to several weeks, a person slowly get adapted to the environment. To the environment means to the low oxygen tension. So the hypoxic effects are reduced and the person will able to ascend further. But how all this process will occur? This process will occur because there will be increase in the RBC production and healing. Okay, so if the low PO2 is there, so what will happen? There will be starting of the hypoxia, means decrease RBC count, decrease availability of O2 to blood, increase demand for CO2. So what will happen? This kidney will start releasing a very important hormone that is known as erythropoietin. So erythropoietin will be there, and erythropoietin is responsible for the stimulation of bone marrow. So if bone marrow will stimulate, so it will cause the increase in the RBC count. And if RBC count will be more, means the acclimatization or adaptation has done by the body. Okay. Now, what are the changes that occurs during the acclimatization that we need to know? So, various changes will be there. Like, first we have change in blood. Okay, so change in blood means there will be increase in RBC, there will be increase in hemoglobin, increase in hematocrit, various things will get increased. Okay, then if we talk about change in CVS, so there will be increase, the overall activity of CVS get increased whenever the person visited to the high altitude. Like there will be increase in heart rate, force of contraction will get increased, cardiac output will get increased, right? Then change in respiratory system. Okay, so pulmonary ventilation will get increased. Okay, then pulmonary hypertension will be there. Okay, increased cardiac output increases the pulmonary blood flow and that leads to pulmonary hypertension. Okay, then due to increased pulmonary blood flow and increased ventilation, diffusion capacity of gases will also get increased. Okay, fine. So these are the changes that occurs in blood, in CVS and in R's, respiratory system. Okay, now next we have the another important topic is this clinical case. Okay, so here a man, 40-year-old man was admitted to hospital with complaint of difficulty in breathing and shortness of breath following head injury. Now explain the physiological basis for the change in periodic breathing. Okay, so in a patient with head injury, periodic breathing can result from the direct impact on the brain stems, the respiratory center, and can alter the chemoreceptor sensitivity, delayed circulation response, and period of central apnea. These factors combine to produce the characteristic cyclic pattern of chain stroke respiration. Okay, so in today's class, we're going to learn about the chain stroke breathing. Okay. So what is this chain stroke respiration or breathing? This is the periodic breathing that is characterized by gradual increase in force of breathing. Okay, so there will be gradual increase in force of breathing. Okay, and there will be decrease in force of breathing result in apnea. Apnea means absence of breathing. Okay, this is the most common type of periodic breathing and it is marked by two alternate pattern of respiration. Okay, what are those two alternate pattern? That is hypertonic breathing and another is apneic period. Okay. So in this hypertonic period, there is the process of waxing and warning occurs. Okay, so what is this hypertonic period? So to begin with the breathing, when breathing get more shallow. Okay, so please allow me to share screen. So we were talking about the apneic period. So here, when the force of is reduced to minimum, so there will be cessation of breathing period will occur for a very short period of time. So this cessation will be there for a very short period of time, and it is again followed by the same pattern, means the hypertonic period. Okay, so the duration of one cycle is about 1 minute, and sometimes the waxing and warning of breathing can occur without the process of apnea, right? Fine. Now, next we have the another important condition that is known as decompression sickness. Okay. So, the decompression sickness means this is the disorder that occurs when a person returns rapidly to normal surrounding from the area of high atmospheric pressure like deep sea. Okay. So this process is also known as compressed air sickness, Kazan's disease, Bent's, driver's palsy. Many names are there. Okay. But you need to remember that why this is named as decompression sickness, because the person gets suddenly returned back to normal surrounding where from the area where there was high atmospheric pressure was present, like deep sea. Okay, that's why this is known as decompression. Okay. So this is also known as bends, and it is a condition rise from the dissolved gases coming out of solution into a bubbles inside the body due to rapid decrease in pressure, and it is most commonly associated with scuba diving because it occurs under the deep water, right? But it can also occur in other situations involving rapid decompression, such as in case of aviation or the space traveling. Okay, now what are the causes of this kind of sickness? Okay, so as we have learned that high barometric pressure at deep sea leads to compression of gases in the body. Okay, so causes is, first cause is high barometric pressure. Okay, then compression reduces the volume of gases, right? Now, another thing, that what are the symptoms of this decompression sickness? Okay, so various symptoms are there that one by one we're going to learn. First, we have whenever there is severe pain in tissues. So severe pain in tissues can occur due to this condition. Okay, so the severe pain particularly occurs in joints. Okay, then there will be sensation of numbness, tingling can occur. Okay, temporary paralysis can occur due to nitrogen bubbles formed in the myelin sheet of motor nerve fibers. Okay, so temporary paralysis. Then most suspected muscle cramps are there. Okay, muscle cramps are there with severe pain. Okay, then fatigue. The person can be unconscious. Then dizziness could be there. Okay, so various symptoms are there that are associated with this condition. Okay, then another thing, that what can be the treatment of this disease? Okay, so if a person is affected by this condition of decompression sickness, so first recompression should be done. Okay, so first decompression should be done, and it is done by keeping the person in a recompression chamber, and then he brought back to atmospheric pressure by reducing the pressure very slowly, because in deep sea there is high barometric pressure is present, and if suddenly the person can come over the normal environment, so obviously decompression sickness will be occur. So this treatment of slowly releasing the pressure will give relief to the patient. Okay, then another thing, that hyperbaric oxygen therapy can be given to patient in such condition. Okay, so this is all about today's class. So thank you so much for watching class, and also for any kind of doubt and questions, you can connect to us with various social media handles like YouTube, Instagram, Facebook, and Telegram. So thank you so much for today's class.